Good afternoon. I am Dr. Mary Alvarez, and I'm going to be spending the next hour with you talking about parental alienation, toxic stress, and your child's brain development. So, a little bit about me as I move through my presentation this afternoon. I am a licensed psychologist. I'm now practicing here in Austin, but I have 20 years experience working in family law matters, both in Houston originally and now here in Austin. And so I have a couple decades of experience working with very high conflict families that involve, in many cases, parental alienation. And so as a former custody evaluator, that's where I became aware of the field of parental alienation, because when matters cannot be settled between parents outside of extreme litigation, judges, attorneys, amicus attorneys, guardian ad litems, etc., there's some element of something that produces and maintains the conflict. And that's where I became aware of this whole field of parental alienation and how parents in some of these very high conflict families will use the children as weapons in order to enact their rage and vengeance towards the other parent. And so I educated myself, started attending conferences. Elaine has been absolutely fantastic in promoting this field, and owe her a lot of gratitude. But that's where I first became aware of the field. Currently, my current work here in Austin includes psychological evaluations. I no longer conduct custody evaluations, but I do forensic psychological evaluations because we know that alienating parents almost always have a personality disorder and other psychopathology. I also work with families and doing family relationship work. That's one role I have with the courts. I do parental alienation evaluations when ordered. I do reunification work when ordered, and I work as a parenting professional. So that's what I do the most here in Austin, is work as that person who is trying to create a path forward for very high conflict families and parents specifically. So here are my presentation objectives this afternoon. I am going to lay the foundation or the predicates for why brain development needs to be, in my opinion, more front and center in the discussion of the effects of alienation, because we have a very vast body of research now that talks about the effects on the brain of toxic stress. And we know that in situations where a child is forced to choose one parent over the other, or in all of the dynamics involved in parental alienation, they create toxic stress. So I'm going to start and just kind of lead everyone into my discussion of toxic stress and the effects on the brain. So we're going to start with just some basic developmental needs of the child. Some basic things that we understand about growth and development, and why that's important is because when that is disrupted, things can go awry. Then I'm going to briefly talk about the adverse childhood experiences and show you where parental alienation falls as far as being considered an adverse childhood experience. Talk briefly about attachment, because that is often disrupted in children who are the victims of parental alienation tactics. Very briefly, talk about domestic violence, intimate partner violence, and the abuse, because that is often a factor in severe alienation cases. Then I'll move into toxic stress in the brain. And I do have some slides that are anatomical, but my goal is not to make this complicated. My goal is to communicate that there are so many systems in the brain and so many brain areas that can be affected, that it really is a universal brain-based problem. It's not just one or two areas that are affected by toxic stress per the research. Then I'm going to finish with outcome studies based on our findings of toxic stress. So the research findings on outcome studies are pretty sobering and pretty grim, which is again another reason to intervene swiftly in these parental alienation cases. And just as a little aside, I want to, I guess, give a plug for the Austin area because the judges here on a much more regular basis than I ever saw in Houston are willing to implement 90-day no contact orders and the kinds of things that we know, the interventions that we know are effective in helping the child reconnect with a parent. So happy to be part of that whole family law arena here in Austin. So first, the obvious, children need and deserve relationships with both parents. All right, and why is that so? A child's internal self is part mom and part dad. In other words, a child's psyche is comprised of both mom and dad. And that was the case for us. You know, all of us follow this developmental trajectory. So this is not unique to high conflict families. This is not unique to parental alienation factors in a family. That we are just wired biologically to have this internal working system where we are part mom and we're part dad. And I think if we all reflect backwards, we can think about as a child or adolescent wondering, you know, how did I get this trait or very obvious physical traits from a parent and being able to detect those. And then later, as you grow older and become more aware, you detect personality traits that are similar to one parent or the other, or traits that are similar to both parents. So that's our internal hardwiring. That's not something we're taught. That's not something that a vaccine, for example, you know, creates in you. We are born with this internal working system that we are part mom and part dad. So why is that so critically important? Because a child's eventual self-identity is comprised of each parent. So the good, the bad, the ugly. You know, parents have plenty of flaws, but that's not, perfection is not required in a parent in order to produce a well-functioning, healthy, psychologically productive adult. All right. Each parent has unique contributions to a child's development. You know, there are things that moms do very, very well that are very, very important for kids, and there are things that dads do very well that are very important for kids. For example, moms traditionally, and this occurs to date across the animal species, you know, moms are the nurturing, comforting caregivers, and that's very important, obviously. Dads are the more playful, they're the parent that is more likely to invest in a little bit of risk taking with the child. Again, not wrong, not bad, just part of a global continuum of psychological developmental positives that can come from each parent. So if you, or if a alienating parent, I should say, are trying to marginalize, minimize, or outright destroy one parent, which is what we see at the severe end of parental alienation, the child's relationship can have a devastating and lifelong consequences with not only the target parent, but with other relationships as the child grows into adolescence and adulthood. And so the consequences are grim, as I mentioned. So attempting to destroy one parent only leaves the child concluding that whatever is so wrong with my dad or my mom, based on, you know, who is the favorite parent, who is the target parent, must also be wrong with me. So for example, when a child hears over and over and over again how dangerous parent A is, how inept parent A is, how parent A doesn't love you like I love you, and you're not safe with that other parent. When that child hears this message or these series of messages on an ongoing regular basis, the things about that parent A that are so bad and so wrong, the child internalizes, well, since I'm part mom and part dad, as I mentioned a few slides ago, all of those things must be present in me. All of those character traits that are so heinous, according to parent B, must be in me. And so what happens is that the psychological development of the child starts to be affected, and self-loathing, decreased self-concept, self-confidence, etc. And I'll get into that a little bit more as we move along here, can all be affected. And so erasing a parent from a child's life is a very dangerous endeavor to do psychologically. So per the research, and this is kind of a foundational slide that I like to use when I do presentations, the largest contributor to childhood trauma in our country is family dysfunction. Okay, let me just repeat that because it's such a profound finding. The largest contributor to childhood trauma in our country is family dysfunction. Right? There's many other traumas that children can be exposed to, but family dysfunction is the biggest trauma that children are exposed to in this country. Half of children who have a mental health need and need to see a psychologist as a child or adolescent, half of them, when you get their histories, have abuse, neglect, and family dysfunction in their histories. A third of adults who end up in a psychologist's office someday for mental health needs, when you get their history, they report abuse, neglect, and family dysfunction. So that's 1 out of 3 adults who seek mental health care, and that's 1 out of 2 children whose parents seek mental health care for that child. So family dysfunction is a huge, huge contributor to current and future mental health needs. So one of the things that we find can be disrupted in children who are exposed to alienating tactics by a favored parent is attachment. And like everything else that you've heard me say up to this point, both parents have roles in attachment. All right, both parents, even though there are differences in caregiving tactics and strengths and weaknesses, etc., between moms and dads, both parents have a role in producing a securely attached child who moves into adulthood with a secure attachment base. So attachment is all about creating a parenting and caregiver environment in which the child knows that his or her needs will be met. The child has a feeling of safety in that environment and a feeling of security. And so just basically, as an infant, the infants are 100% dependent on caregiver behavior for their survival. And so starting in infancy, starting at birth, right? These are newborns. When a child cries, his or her needs are met. They're fed, they're changed, they're held, they're comforted, etc. And so when that pattern continues through the newborn period, into infancy, into toddlerhood, that child has developed a feeling of safety, that my world is safe because big people, adults, take care of me. And that's extremely settling for a child. And so the goal is secure attachment. So let's talk about the gold standard for a secure attachment style. This is what we want children to achieve. We want them to feel as newborns, babies, and toddlers that they can trust the world, that the world is a relatively safe place, and that they can rely on other people when they need to. So as an adult, if you came from an upbringing that allowed you to develop a secure attachment style, you are trusting and empathetic towards other people. You have those internal qualities and traits that are profound. You are able to navigate interpersonal relationships in a healthy way. That means you are able to get along and navigate with not only intimate partners, but neighbors, colleagues, strangers in grocery stores. And you have a regulated emotional system as an adult. And that is huge, because what we find in parents, especially parents who engage in alienation tactics at the severe end, they too have a very dysregulated emotional system. And so the gold standard is a secure attachment. What happens if that doesn't occur in infancy, babies, and toddlers? We call that an insecure attachment style. And there are 3 different insecure attachment styles. And again, my goal is not to belabor this issue, but this is important information that sets the stage for brain development. And so let's talk about the ambivalent, anxious child. So children, adolescents, and then into adulthood who have an ambivalent or anxious attachment style come from backgrounds in which the child was very distressed when the caregiver would leave, instead of feeling securely attached and knowing that the caregiver will return. And it's the result of poor parental availability. So these are parents who were either physically or emotionally, or both, largely unavailable for their children. And so when a child cried, those parents were not consistent. So they were very inconsistent in their ability to meet their child's needs. And so that creates anxiety in a child, because you never know. If I cry, I need something, I hurt myself, I need a Band-Aid, I'm hungry. You never know if that parent is going to be available to you. And so you develop anxiety. Another insecure attachment style is what we call the avoidant or dismissive attachment style. And this is a child who over time just avoids the caregiver, because experience has shown that child that it doesn't matter. It doesn't matter what I need, what I do to show what I need. The caregiver is unresponsive. This is a result of neglectful and abusive parenting, physical, psychological, or sexual abuse. And we know that alienating parents, by definition, meet the criteria as a psychological abuser. The third attachment style that is considered an insecure attachment is a combination of the first 2. And it's called disorganized, anxious, ambivalent. And so this is the most alarming attachment style, because all of what I just discussed had been happening to this child. So the child, as a child, adolescent, and into adulthood, displays a disarray of behavior, including at the time that they were a child, resisting that parent, presenting as confused, avoiding a parent, yet at other times seeking a relationship with that parent. And so there is this yin and yang, this push and pull, with the child moving towards that parent and away from that parent. It's a result of inconsistent parenting, including a parent that scares a child in some ways, but also provides comfort at other times. And you can imagine how confusing that would be for a child. So think about this in the context of an alienating parent. There are times that parent scares the child as related to the target parent, when that parent presents the target parent as inept and dangerous, etc. Those things scare a child. But then that parent turns around other times and comforts a child for behaviors that we know are exhibited by alienated children. And so when the child plays along or follows suit with the alienating parent, they're rewarded with comfort, attention, etc. And so this just explains why, when you hear along the way in various sources or from various people that attachment can be affected in alienation cases, this just background to understand how that can come to be. So let me move into studies briefly, domestic violence, and then we're going to get into the toxic stress response, because that is the basis of the brain changes that we see per the research in children. And then I will discuss with you some of the outcome studies that we have related to children who exist in high conflict families and children who exist in a family where alienation was a factor. So let's move into adverse childhood experiences. This is a series of longitudinal studies that have unfolded over decades and have provided us with valuable information about what childhood experiences can do to growth and development, physical growth and development, as well as mental health growth and development. And you'll see on my slide, I'm going to go through the 10 areas that are considered adverse childhood experiences. And the ones in red are the ones that we have noted are involved in alienation. And so you can see out of the 10 categories, 5 of them, half of them, meet the criteria for what happens in alienation. So abuse is a category. So there's physical, sexual, and emotional abuse. Again, we know that parents who engage in alienation tactics are emotionally abusive. The second category is neglect, and that includes physical and emotional. Again, household adverse experiences include mental illness in a parent. Again, we know that at the severe end of the continuum, one of the parents almost always has a severe mental health diagnosis, such as a personality disorder. Separation and divorce, that alone is considered an adverse childhood experience. And so for all the families who don't have high conflict and don't go through the family law system, years at a time, but just have a straightforward, simple divorce, that factor alone creates one adverse childhood experience for their child. Incarceration of a parent is another adverse experience that a child may have, as well as substance abuse in the home. One or both parents have a substance abuse or addiction. And then exposure to domestic violence. Now, domestic violence is more than physical violence. It's emotional violence. It's dominance, control, and power, the intimate partner violence. And so those are 5 areas out of the 10 where we could say parental alienation involves those 5 factors. And so these children who come from alienation backgrounds have a huge disadvantage as they're moving into adolescence and adulthood. So what do adverse childhood experiences contribute to? Okay, again, per the research, these longitudinal studies are very nice because they can watch children for years, well into adulthood, and measure the metrics of their development. So first of all, ACEs create a toxic stress response, which I will get into here as we move along. ACEs are considered developmental trauma, and they contribute to chronic lifelong health problems, such as increased incidences of heart disease, decreased lifespan. So if a child comes from a history of ACEs and they are, the more ACEs that you have, the more categories that you can identify that you had in your childhood, the more lifelong problems that you have. So decreased lifespan is one of them. They simply just don't live as long as a child who did not come from a background of adverse childhood experiences. Increased risky behavior, that is a function of changes in the brain and in the frontal lobe. And increased mental health diagnoses, including addictions. So depression, anxiety, personality disorders, addictions are all found in higher rates in adults who have histories of adverse childhood experiences than comparable adults who did not have those adverse childhood experiences when they were growing up. So as I mentioned, separation and divorce are considered an ACE. That alone, puts your child at risk. But parental alienation on top of a separation and a divorce, just profoundly increases, the toxic stress response and what we call developmental trauma. So just to remind you, because I think this is very important, here's where parental alienation is identified as an adverse childhood experience. It falls under domestic violence, all right, especially at the severe end of the continuum. It falls under emotional abuse because trying to turn child against a parent and ruin that parent-child relationship is emotional abuse because children are not wired to have to align with one parent against another. And it's emotional neglect. You are neglecting your child when you are so focused on hurting the other parent and using your child as a weapon. So just briefly, because there's been a lot of research from Jennifer Harmon out of Colorado State University on this issue of domestic violence and parental alienation. I think it's very worthy to just mention some of the findings that come largely from her research, but not entirely, from her research. So domestic violence and parental alienation, it's actually known as intimate partner terrorism or coercive control. And that's because, and I see this all the time in these families that I work with here in the Austin area, there is a large imbalance in power between the parents. And it's not about parenting the child post-separation and divorce. It's about power and control, all right, which is more difficult to achieve when the parents separate and divorce. When both parties were under one roof, the domestic terrorist had unfettered access to the other parent. Well, that's not the case anymore in a separation or divorce. And so that's where the children become the weapons. And they are used as weapons against the parent, not because of parenting issues or because that parent is inept or incapable. It's because the domestic terrorist continues to try and enact that power and control. The domestic terrorist almost always has a personality disorder, which I've mentioned several times. So there's generally some pretty significant psychopathology involved. And the pattern of domestic violence, intimate partner violence, is almost always unilateral, meaning it's one parent enacting the terrorism on the other parent versus a bidirectional, both parents are engaged in weaponizing the children and enacting this intimate partner violence. So specifically, in 80% of situations in which an alienation was identified as a factor in these families, the favored parent had all of the control, which is called asymmetrical dependence. And this is Jennifer Harmon and Mandy Mathewson's research from 2020. So 80% of situations, one parent had all the power and control. I mean, that imbalance is just profound. The favored parent constantly felt threatened by the loss of control. As I mentioned, when both parties were under one roof, you had unfettered access, to enact your domestic terrorism. So that parent constantly engages in intimate partner violence using alienation tactics to maintain the power and control from afar, from two houses. So children can be exposed to violence either directly or indirectly. As we know, they're either, brought fully into the fold or they witness the alienating parent acting very badly, overhearing conversations with other people, etc. Children exposed to intimate partner violence experience negative psychological effects, and I'm going to get into that, but I'm just providing you with 3 different sources of research to really illustrate that this is no longer something that is being, investigated as a possibility. The research is now coalescing around these findings. And these children, as they grow older, have very poor social adjustment. Their educational performance is affected. They don't reach their potential, for example. And there is an increase in behavioral disorders, according to Douglas and Hines from 2016. And my last slide on this, additional parallels between abusers and alienating parents. I thought this is very profound. So let's look at the upper right part of this screen, and it says coercive abusers. They have increased pathology, psychopathology. They themselves have histories of unresolved trauma, and it's all about maintaining power and control. Now let's look at the bottom left side of the screen. The alienating parent has increased psychopathology, has unresolved trauma from his or her history, and it's all about maintaining power and control. And so there is a direct relationship between coercive abusers, and the favored parents in the severe alienating families. What about psychological and emotional abuse? I mean, what does that really mean? All right, so let me just introduce you to some basic psychological and emotional abuse. This also affects brain development and neurodevelopment. So psychological abuse, just very simply, is something that affects and creates psychological impairments. It affects growth and development across the board almost, and it's considered injury. So what is an emotional injury? Well, that is every time an alienating parent tells a child how horrible and bad the other parent is. That parent is telling the child that half of him or her is also horrible and bad. Again, I'm trying to, just kind of reconnect dots backwards for you as we move into how all of this affects brain development. So that's an emotional injury. So if you go into adolescence and adulthood thinking that half of you is bad and horrible and not worthy, I mean, it's not a far leap at all to understand what happens. And here's what happens: depression, low self-confidence as you enter adulthood, overwhelming and chronic feelings of just being inadequate, no matter your performance, no matter measures of your performance, grades, promotions at work, etc. It's that nagging feeling inside of you that you're just inadequate. You go into adulthood thinking that you're just a horrible person and you feel damaged. All right. There's just this internal working of I'm just damaged because I heard all of these things growing up about how horrible my dad was or how horrible my mom was. And I'm half of that person. So I guess I'm horrible and damaged. So that's the background briefly in several different psychological areas that leads us into toxic stress and developmental trauma. All right, so I'm going to spend the rest of my presentation diving into this. So just to remind everybody, I have 2 slides here that are a repeat of previous slides. Children need and deserve a relationship with both parents. All right, I think we all agree on that in this format. A child's internal self is comprised of both mom and both dad. All right, that developing psyche is a combination of both of my parents and all of the traits that they have, the good, the bad, the ugly. All right, toxic stress, trauma, and anxiety. So when a child lives between high conflict parents and the parent-child relationship suffers as a result, what is the risk? The risk is the toxic stress response. All right, that is the risk. That in and of itself doesn't produce the brain changes only under certain conditions, which I'm going to explain to you. But first, let me just take you through some basic organization of the human brain, because there's many areas of the human brain, but we're only going to focus on a few of them. But as I mentioned earlier, my goal is to help you understand that there is widespread damage, potential damage, to the brain. It's not just restricted. The toxic stress response doesn't just restrict itself to one area of the brain or 2 areas of the brain. But when we talk about the brain, let's talk about it in the terms of how does information move through our brain, because that's important when we talk about toxic stress. So essentially, if you look at the bottom of this slide where it says brainstem, the area right above your neck, all right, information enters from our environment, all right? You're listening to me. Well, the information that I'm presenting to you is entering your brainstem, and then it moves in an upward trajectory. So it goes through the limbic system, which is the areas right over your ears on both sides of your head. That is the feeling system. For our purposes, it is involved in many other things, but it's where our feelings are processed, including anger and rage. And if the toxic stress response is not activated, the information moves into our cortex, which is the whole part of our brain underneath our forehead. That is the highest level part of our brain and involved in the most complicated processes. cognitively. And I'll give you some examples of those as we move along. So in a non-threatened environment where the toxic stress response hasn't been activated, information enters towards the back of the head and moves forward until it's finally processed up here, which is good. And so you can see on the right-hand side of my screen, simple functions are managed by the brainstem, and then our complex functions are managed by the frontal lobe. So let me dive in just a little bit deeper into the brainstem. So information here, or the brainstem's functions here, involve consciousness. The fact that we're all conscious right now and you're listening to me means that your brainstem is working. It is involved in our blood pressure, maintaining or not, breathing, heart rate, and sleep. So what all of these have in common is they're very basic survival functions that we don't even think about. Right? We don't think about our heart rate. We don't think about breathing. It just happens because our brainstem is making sure that the heart, the lungs, etc., our vascular system are all being activated. So it's not that we have to think about getting up in the morning and making sure our blood vessels are working. Let's move up into a little bit more complicated area of the brain, the limbic system, all right, which is right above your ears, okay? This system is involved in emotional regulation, all right? It's also involved in memory. This is where memories are consolidated, and the process of storing memories throughout different areas of the brain happens in the limbic system. It's also involved in things like motivation. The toxic stress response affects this area greatly, all right, which is why I want to illustrate this. Anger and rage are also managed or mismanaged through the limbic system. And so when information becomes bottlenecked in the limbic system, it comes through your hindbrain, your brainstem into the limbic system. And if you're very emotional, the situation is very emotional, the information is not going to make it to your frontal lobe so you can think about it and you can problem solve the situation. It gets all bottlenecked in your limbic system. And that's why when we experience something that is emotionally charged, and later after we calm down, we have the ability to think about it, we say things to ourselves like, well, I wish I would have said that. Let's say you're having an argument with somebody that was very emotionally charged. Well, that, I wish I would have pointed that out. So all of these after the fact thoughts that you have that you couldn't have at the time that the event was unfolding because there was too much emotion involved, that explains it. Because everything gets bottlenecked right here and it doesn't make it to the frontal lobe for you to be able to think about it. So speaking of the frontal lobe, these are some of the main functions. If information can make it to the front of our brain, this is where the higher level cognitive abilities happen. Problem solving, analytical thinking, deductive and inductive reasoning, planning and organizing, a task, an event, whatever, judgment, and impulse control. All right, so these are our most highest level thinking abilities. And of course, we want to access these, but it requires that your brain be in a calm state so that the information can reach your frontal lobes. So essentially what I'm saying is our brain is organized to act, okay, which is the brainstem that keeps us alive, followed by feeling, because then the information has to pass through the limbic system. Lastly, thinking. And so our brain is organized to act and feel before we think. That's just the way it is. Okay, so you can see the trajectory through the brain. And again, simple functions, although life-saving functions are happening in the brainstem, our most complex cognitive abilities happen in the cortex, the frontal lobe. So what is the autonomic nervous system? Well, people who don't study the brain know it as fight or flight. It's that system that we have inside of us that's automatic. Again, we don't sit and ponder and think about, well, should I run? Should I fight? Should I freeze? It's an automatic response to threat, danger, trauma, or chronic stress. All right, so it's something that we all have. It has a role in the survival of our species, and it's something that is just develops in us as part of our growth and development. So we're all hardwired to have this automatic reaction to danger. Our brains release several chemicals, such as, these are things that might ring a bell with you, cortisol, adrenaline, but another one that's probably less familiar is called norepinephrine. But they're all related to the same purpose, to help us react very quickly. So once, an example in our world, let's say you're in a parking lot at Target, and as you're moving between cars to find your car and return to your car, another car comes barreling down the row at a high rate of speed. Well, your autonomic nervous system is going to react very quickly and allow you to jump out of the way. You're not going to think about it. You're not going to think, stop and ponder, okay, that car seems to be going about 40 miles an hour, and I've got about 3 seconds to react here to get out of the way. Nothing happens like that. It just automatically creates a way for you to jump back. So normally what we need to have happen as far as brain development and brain consequences, once the threat, the car has raced off, has abated, then our nervous system recovers and returns to baseline. So you'll feel your heart rate decreases, your breathing returns to normal. All of these are affected by the autonomic nervous system and that reaction response. So the cortisol, the norepinephrine, the adrenaline, all of those chemicals return to baseline. All is good. Okay, that's the way everything is supposed to happen for us. But what happens with toxic stress? What creates this? And what are the consequences thereof? So when children are exposed to chronic parent conflict, the chronic stress response or the toxic stress response can cause their systems, that autonomic nervous system, to remain in the on position. All right, so a system that is designed for a short-term use to face a threat doesn't return to baseline. It stays on. And so what that means is the adrenaline, the cortisol, the norepinephrine, those very important chemicals remain in the on position and continually are released by our brains versus returning to baseline. So this creates what we call a priming effect. And this will explain children's behavior, not just children who are involved in alienation, but all children. So a priming effect explains why a child remains chronically anxious. And very common obstacles in life. Your friend can't spend the night. You can't find your favorite pair of shoes in the morning. Things like that, just normal childhood things could send that child off the edge psychologically. I mean, into a serious meltdown, anxiety bout, defiance, etc. Because that child's brain, it always stays primed. And so I created this little diagram here to illustrate what I just said. Let's look at it visually now. So look at the bottom cylinder. All right, that cylinder has a long slice of yellow. And this is in an unprimed brain. This is in a brain that is not in the on position for the toxic stress response. This is a brain who has a flare-up of the toxic stress response, but returns to baseline. So their resting stress, the red part of the cylinder on the left side, again, the lower cylinder, is pretty low. All right. So when something stressful happens, they have a lot of room, that the rest of that cylinder that's in yellow, to react. But look at the upper cylinder. That's called the primed brain. This is a brain where the toxic stress response doesn't abate, and those neurochemicals continue to be released. So their resting stress level, that red area of that cylinder, is much bigger. All right. This is the brain that we high conflict. Their brains just are always activated. And so their resting stress level is very high. And so, as I mentioned, a child can't find shoes in the morning. Well, their resting stress level is already, at the edge. And so not finding your shoes pushes them over into some kind of an emotional event. And so this is just another way to illustrate visually this priming effect. So when children have trauma, one of the things that is affected is serotonin. And I think that we're all at least partially familiar with what serotonin is because of antidepressants. Antidepressants target the serotonin system in our brains. So serotonin is very, very important. It's involved in mood and mood regulation. And depression is a mood dysregulation. Therefore, antidepressants affect the serotonin system. Childhood trauma dysregulates the serotonin mood system. Childhood trauma dysregulates serotonin. All right. Decreased serotonin is related to not only depression, but anxiety, aggression, and certain personality disorders. All right. So just going backwards, I mentioned that severely alienating parents almost always have some pretty severe psychopathology. And you heard me mention depression, anxiety, personality disorders. So I'm just connecting the dots. And I also mentioned previously that alienating parents almost always have their own early histories of trauma, abuse, and neglect. All right. So you can see that they are where they are based in part on their own histories. It's not an excuse, it's just an explanation to help you understand why some parents can be so heinous and so cruel to their child. Oxytocin is also affected by trauma. Oxytocin is a chemical in our brain that is involved in interpersonal interactions and relationships. So very important. It helps us mediate and modulate our interactions with other people. It's also involved in social memory, emotional recognition, empathy, and attachment. So oxytocin flows very freely during attachment periods early on in a child's history. It's involved in the regulation of stress, and decreased levels of oxytocin have been found in adults, all right, as measured in adults who had abuse histories, especially emotional abuse. And again, we know that parental alienation is emotional abuse. Here are some of the consequences of a toxic stress non-ending response. All right, so we know that on the left side, let's talk about psychological disorders. These all are increased in frequency: PTSD, depression, anxiety, antisocial behavior, and these individuals are at a much higher risk for drug and alcohol disorders, addictions. Now, the section at the bottom of this left-hand side, childhood traumas that are interpersonal, which is parent-child relationship, intentional, which is what happens at the severe end of parental alienation. A parent is weaponizing the child, and chronic are particularly associated with not only the psychological disorders on the left side of my screen, but also the neuropsychological deficits on the right side. So from a neuropsychological perspective, these all decrease memory, learning, executive functions, IQ, and academic performance, language processing, visual spatial skills. So essentially processing across the board, as well as 3 anatomical differences. There's a smaller prefrontal cortex that is right here. There's a small area underneath your frontal lobe that is called the prefrontal cortex. And again, remember, those are our highest level thinking skills, smaller. Less prefrontal white matter, which are the axons which deliver information between different parts of the brain and speed information along for more effective processing. There's less of that, so there's less efficient information processing. And then a smaller corpus callosum, and I'm going to show you what that means. That's a bundle of fibers that communicates between the 2 hemispheres. That is smaller. So again, less effective information processing in the brain. These are consequences of toxic stress. So they're pretty profound. They're pretty sobering. Brain consequences from abuse. And again, we know that parental alienation is considered emotional abuse. There's 5 points on my slide from 5 different studies. Again, my point is to illustrate that these are not unsubstantiated claims. Decreased verbal declarative memory. So what that is, these are our memories of our past. These are our memories of details of our past related to what was the name of our pet? Who was our first grade teacher? All right. So we're losing, or these children are losing, important pieces of their past that didn't have to do with abuse at all. A smaller overall whole brain in brain volume. Alterations in the cerebellum, all right, which is back here, and it's involved in balance and gross motor movements. Increased norepinephrine and cortisol. I talked about that. When that toxic stress response stays in the on position, norepinephrine and cortisol are continually released, which is not what is supposed to happen in our brains. And the consequences are what we're discussing. And then a smaller hippocampus, and that is involved in memory. All right, so I'm going to go through a few of these areas that I think are really important just to further illustrate. So one of the neurological functions that decreases when you have the toxic stress response unabated is language processing. That includes expressive, I'm expressing myself, receptive, you're listening to me, that's receptive language, written language, and things such as phonics. Executive functions that decrease, because that was one of my little bullets. Those include higher level thinking skills, reasoning, problem solving, judgment, and impulse control. And then just to illustrate, because one of the little slides said visual spatial skills, well, what does that mean? That means you have less ability to orient yourself to the space around you. You have more difficulty following maps, for example. Tying your shoes could be affected. And the conception of distance, your perception of distance between yourself and the tree, for example. So these are areas that people don't spend a lot of time thinking about, but are affected by ongoing toxic stress response. I mentioned the corpus callosum. Let me just give you a visual of it. This is what it looks like. It's deep in your brain, but it communicates information, passes information between the right and left hemispheres. So that is smaller in individuals who have histories of the toxic stress response. So information is going to be less effectively processed. You heard me mention the hippocampus. All right, let me just give you a visual of where that is. You've got two of them on the right and left sides. It's smaller in volume. It's involved in memory consolidation. It helps with memory storage. Again, another very important area of our brain. And the changes in the cerebellum. Okay, just want to let you know where it is. All right, it's deep, again, back there by the brainstem, involved in gross motor skills. So lastly, let me finish up with outcome studies. All right, here's what we know can happen to children who have histories of chronic conflict in their families and or parental alienation. So Amy Baker produced this back in 2006. Previously alienated children as adults. All right, here's what they look like as adults. 70% of these now adults experience depression. The base rate in our country is 8. 8 out of 100 adults would meet the clinical criteria for depression. 70% of previously alienated children met the clinical criteria for depression. 65% identified with decreased self-worth. 50% were alienated from their own children. I'll talk about that. 40% had trust issues. All right, that's an attachment system disruption. And another sobering outcome was 35% of previously alienated children, now adults, struggle with addictions. Our baseline rate in our country is 10%. So 1 out of 10 adults struggle with addictions. 35%, 3.5 out of 10 adults struggle with addictions. Pretty profound results. So let me just illustrate the two that I found most sobering. Our population base rate for depression is 8%. 70% of previously alienated children struggle with depression. And let me go through the addiction one more time. So our population base rate for addictions is 10%. 35% of adults who were previously alienated struggle with addictions. So there's a lot of inappropriate self-medication. What about that statistic that half of children who are alienated from their own children someday? Well, what could explain that? So this multi-generational effect. So as children, poor parental role models in childhood, alienating parents and target parents don't act very good. Target parents are reactive. You know, the alienating parent is deliberate and methodical, but the target parent, of course, is upset and angry, and it's difficult, you know, to be a child with that parent as well. Disrupted attachment systems, lack of ability to form healthy adult relationships, including as a parent, you missed those opportunities to learn how to develop and maintain relationships. And then that parent's own psychopathology someday. I just took you through all of the consequences for an ongoing toxic stress response, and it creates a lot of psychopathology, depression, anxiety, personality disorders, etc. What about high conflict divorces? All right, there's a lot of high conflict divorces that include parental alienation, but they don't rise to the severe level. So let's talk about what happens to those children. 65% had anxiety severe enough to require counseling. More than half of them have an attachment disorder. So they have one of those three styles of an insecure attachment. Almost half had abnormal fears and phobias. That's an overactive toxic stress response system. 44% become physically aggressive, or they act out. And 31% had sleep disorders, a basic function of our brainstem. All right, a third of them had disrupted sleep. And that, of course, as children, affects your day the next day, in school, in sports, in your social interactions. Here's a more recent study than Amy Baker's study, but it is consistent with and supports her findings. This was done in 2022 by Verhar et al. So these are, again, previously alienated children, but they're now adults. Depression and anxiety, 55%. Eating disorder or body image problems, 20%. Personality problems and or disorders, 40%. Psychosomatic symptoms, which is an anxiety-based disorder, 10. Self-harm behaviors, 15. Suicide, ideation, or attempt. Suicidal ideation alone was 30%. So there's a lot of emotional dysregulation and instability in these adults who were previously alienated. Here's addictions. Alcohol consumption starting in adolescence. More than half started drinking in adolescence, these alienated. They were involved in the alienation at that time. Drug use, specifically marijuana, 35%, and a sex or pornography addiction, 10%. So my takeaways this afternoon are: damaging the relationship between a parent and a child has psychological and neurodevelopmental consequences. All right, we are not wired to have a damaged relationship with a parent. These negative psychological and neurodevelopmental consequences to children can be profound. I conclude that. I presented the science and research that supports that it is profound. Children suffer toxic stress and are affected as children and adolescents. All right, that toxic stress response can make changes in the information processing systems of our brains, as well as anatomical changes, structural changes. And previously alienated children who are now adults can and often do have serious psychological disorders. And so all of the work that we're all doing in this area is so important, and I applaud everyone for all of our hard work and these presentations giving us the ability to share our information and disseminate what we know from the science and research. So thank you, everyone. I appreciate being able to present this afternoon.